Hi, my name is Virko Carr, and I am a second-year UMass Amherst student studying nutrition. Today, we will be discussing the impact of COVID-19 on depression and nutrition. As many of you know, COVID-19 is a highly contagious and infectious disease that affects different people in many different ways. It has taken a toll on millions of lives worldwide. Most people infected will experience mild to moderate symptoms, including fever, cough, and body fatigue. However, others can become severely ill and have lasting complications or even death. The virus primarily spreads through droplets of saliva in the nose when an infected person sneezes or coughs. Spread is more likely when people are in close contact with one another. It may be possible that a person can get COVID-19 by touching a surface or object that has a virus on it, and then touching their own mouth, nose, or possibly their eyes. At this time, there is no known vaccine to treat coronavirus. Therefore, it is highly recommended that people of all ages worldwide should practice social distancing and respiratory etiquette in order to prevent the spread of COVID-19. Unfortunately, the coronavirus disease has become very stressful for many people. Fear and anxiety about a new disease and what could happen can be overwhelming and provoke strong emotions. Social distancing, quarantining, and stay-at-home orders can make people feel isolated and lonely, increasing anxiety and depression. Since the start of the COVID-19 pandemic, mental health issues have become more prevalent and critical. As seen here, the pandemic has caused a significant increase in anxiety and depression. Over half of the U.S. population has experienced worry and stress related to the pandemic, and 40% of U.S. adults reported struggling with mental health or substance abuse in late June. The pandemic has negatively impacted millions of lives and will continue to do so. Now, what exactly is depression? It is a common and serious mood disorder that negatively affects how you feel, the way you think, and how you act. It leads to a variety of emotional and physical problems. Depression can dramatically decrease mood and interest in activities, causing significant impairment in daily life. In addition, low levels of serotonin, dopamine, and norepinephrine play a major role in depression as they are the neurotransmitters that affect mood. Depression is linked to inadequate appetite, decrease in physical activity, isolation, and low energy. However, nutrition can play a key role in the onset as well as the severity of depression. The noticeable food patterns that precede depression are the same as those that occur during depression. These include poor appetite, skipping meals, and a strong desire for sweet foods. There is often a deficiency in adequate nutrients, including essential vitamins, minerals, omega-3 fatty acids, proteins, and carbohydrates. First, let's talk about carbohydrates. They are naturally occurring polysaccharides and play an important role in mood and behavior. Diets low in carbohydrates tends to precipitate depression, since the production of serotonin and tryptophan promote the feeling of well-being. However, diets rich in refined carbohydrates, like white bread, sugary snacks, and beverages, is linked with depression, especially in women. It is highly important to incorporate healthy carbohydrates into your diet, including whole grains, quinoa, vegetables, legumes, and some fruits. When you eat healthy carbohydrates, your body makes more serotonin, the feel-good hormone that is boosted when you are on an antidepressant. This will hopefully prevent depression. Now let's talk about proteins. Many neurotransmitters in the brain are made from amino acids. If there is a lack of amino acids, especially tryptophan, that synthesize dopamine and serotonin, an individual can experience low mood and aggression. Some foods that contain essential amino acids for the production of serotonin and dopamine are beans, lentils, nuts, fish, and eggs. However, consuming high levels of certain amino acids commonly found in commercially whey protein shakes, including leucine, valine, and isoleucine, may lead to increased depression because it alters the function of tryptophan. In general, tryptophan is the main amino acid that helps fight depression. There are two types of essential fatty acids, omega-3 and omega-6. Omega-3 is an essential fatty acid that is found in less amounts than omega-6. The lack of omega-3 can trigger major depression because omega-3 is found to help treat depression. A trial led by Dr. Andrew Stoll from Harvard Medical School gave 40 depressed patients either omega-3 supplements versus placebo and found a highly significant improvement in depression symptoms. Foods that contain EPA, DHA, and GLA have been found to be effective in reducing symptoms of depression. Now let's talk about vitamins. Individuals suffering from depression often lack supplementation of vitamin B2 and B6 and folate because they trigger symptoms in the nervous system and red blood cells. In addition, vitamin C and D can also boost mood and cognitive function and can possibly reduce symptoms. According to a study reported in Neuropsychobiology, supplementation of 9 vitamins, 10 times in excess of the normal recommended dietary allowance for 1 year, improved mood both in men and women. Therefore, vitamin supplementation is highly important to prevent depression symptoms. Lastly, we are going to talk about minerals. Calcium, chromium, iodine, iron, lithium, selenium, and zinc all play an important role in an individual's mood and behavior. A recent study demonstrated that the iodine provided by the thyroid hormone ensures the energy metabolism of the cerebral cells, playing an important role in cognitive function. Zinc is primarily found in the hippocampus, which is responsible for memory and mood. Studies show adequate intake of zinc can lower depression. Iron acts as a cofactor for enzymes that produce neurotransmitters such as serotonin, norepinephrine, and dopamine. A study of 100 women found a correlation between low hemoglobin levels and an increase in the severity of depression symptoms. Lastly, a study showed those with the highest selenium concentration in their food had the highest mood scores and lowest anxiety levels. Minerals play an important role in fighting depression symptoms. Overall, scientific evidence suggests that a well-balanced nutritional diet can help relieve depression. In order to boost your mood during these unpleasant times, it is recommended to increase omega-3 fatty acids like fish and seeds. Look for a supplement that contains EPA, DHA, and GLA. You should increase the consumption of tryptophan, which is an amino acid that synthesizes serotonin. It is strongly encouraged to increase your intake of B vitamins. Lastly, avoid artificial sweeteners and unnatural sweet foods in order to balance your blood sugar. By incorporating a variety of high nutrient content foods, people can help relieve depression during a pandemic and possibly minimize the severity of symptoms if contraction of COVID-19 occurs.